quality health centers, community health centers make an impact because they allow access for individuals.
Qualified Health Center has always been the safety net in the healthcare center. We are not designed to compete with hospitals. We're not designed to compete with private offices. We're here for anybody who needs healthcare, and you're welcome to come. We're here to work with you.
What NorthShore needs from us is to make sure, as a member of Congress, I'm supporting that by prioritizing and making sure it has the funding that's possible to be able to service the individuals. When he talks about grants that he's able to receive from HRSA to be able to do mammograms here locally, and to eliminate a middleman or eliminate transportation, because all our populations don't have transportation. So if they can make their way here and they can get a mammogram, then you're preventing cancer, and you are being aggressive, and you are doing all that you can as a community health center to make sure you are taking care of the health of your community.
We have expanded the Hammond location from 19 exam rooms to 38 exam rooms here. We've also expanded our service scope, so we have a full service site with all of our services offered under one roof.
Not only is it the preventative medicine, not only is it day-to-day family practice and pediatricians, but it's also an expanded scope when we talk about behavioral health, when we talk about optical, when we talk about dental. Those are services that the community needs, and when they can't afford it, then the whole health of the quality of health of those individuals begin to deteriorate, and then the costs shoot up. So qualified health centers actually increase our ability to be preventative in bigger schemes of health crises. So we talked and signed a letter of support, making sure that programming dollars are increased. Because what we learned from the pandemic is access is one of the most important parts, especially in our vulnerable populations and our Black and brown communities. So what we're doing here is we're addressing that issue.
Congress working with telehealth and things like that allowed us to utilize technology to reach the patient where before we couldn't, and also the funding to keep us going during the pandemic until we could get to the other side and start being on our own again. I think everyone during the pandemic had realized